Hi, my name is Courtney Russo and my PowerPoint is over diphtheria. What is diphtheria and what causes it? Diphtheria is a serious bacterial infection that usually affects the mucous membranes of your nose and throat and is caused by strains of Corynebacterium diphtheriae or C. diphtheriae that make a toxin. This toxin is what causes people to become ill. Diphtheria is extremely rare in the United States. Signs and symptoms. Signs and symptoms of diphtheria typically begin 2 to 5 days after a person becomes infected. These signs and symptoms include a thick gray membrane covering your throat and tonsils, a sore throat and hoarseness, swollen glands or enlarged lymph nodes in your neck, difficulty breathing or rapid breathing, nasal discharge, fever and chills, malaise, rashes or ulcers, and coughing. Virulence factors and pathogenesis. The main virulence factor, C. diphtheriae, is an exotoxin released by the bacteria after entering the human body. Other virulence factors besides diphtheria toxin are adhesions, hemaggglutins, and surface-exposed non-fimbrial proteins, which play an important part in the internalization of the pathogen into the host cell. The pathogenesis in susceptible individuals are toxigenic strains that cause disease by multiplying and secreting diphtheria toxin in either nasopharyngeal or skin lesions. The diphtheric lesion is often covered in pseudomembrane composed of fibrin, bacteria, and inflammatory cells. The pathogenesis is based upon two primary determinants. One, the ability of a given strain of C. diphtheriae to colonize in the nasopharyngeal cavity and or on the skin, and two, its ability to produce diphtheria toxin. Ways of transmission and epidemiological data. The individual who is infected can be contagious for up to 4 weeks, even if there are no symptoms shown. The most common way diphtheria can be transmitted is through the air. When an individual is infected, the respiratory droplets from sneezing and coughing become airborne, which can infect other individuals around. Diphtheria spreads very easily this way, especially in large crowds. Although not as common, another way diphtheria can be transmitted is from handling objects which the infected individual has touched or by touching an infected wound. Diphtheria, although easily transmitted, is very rare in the United States with less than 1,000 cases per year. However, the continents and regions such as Asia, the South Pacific, the Middle East, Eastern Europe, Haiti, and the Dominican Republic, this infection is much more common in comparison to the US. This very rare infection is also deadly. Even with treatment, about 1 in 10 people with respiratory diphtheria will die. Diagnosis. Typically, the doctor can decide if an individual is infected with diphtheria by examining the signs and symptoms shown. The main sign shown is a gray coating on your tonsils. However, to further clarify the diagnosis, the doctors can swab the back of the throat or nose to test and try to grow C. diphtheriae. To accurately identify C. diphtheriae, a gram stain is performed to show gram-positive. The toxicity of C. diphtheriae strains can be determined by a variety of in vitro and in vivo tests. The most common test is vitro assay for toxicity, is the ELIC immunodiffusion test. This test is based on the double diffusion of diphtheria toxin and antitoxin in an agar medium. Prevention and treatment. The best way to prevent catching this infection is by receiving the vaccines for diphtheria. In the United States, there are 4 vaccines used to prevent diphtheria: DTaP, Tdap, DT, and TD. Each of these vaccines prevents diphtheria while also preventing tetanus. Vaccines only last about 10 years, so after the age of 6, you should receive the vaccine every 10 years afterwards. Diphtheria is a serious condition and should be treated quickly and aggressively. The first step of treatment is an antitoxin, which is used to counteract the toxin produced by C. diphtheriae, and then antibiotics such as erythromycin or penicillin may be prescribed to help clear up the infection.